This is Sandy. He's fallen off a semi-trailer.
And we should prioritise trying to get a collar on.
Slurring his words, very confused.
He's definitely got the head injury.
He's complaining 10 out of 10 back pain.
Just popping a collar on. Keep your neck nice and still.
He could have bleeding within the skull.
Can you open your eyes? Sandy, open your eyes.
You were by my side, came to my aid. Look inside my eyes and help me try to ease the pain. You're my lifeline, tell me it's gonna be right. You're my lifeline, reach out your hand, take mine.
Very worried for you, my friend.
The bone's been smashed to bits.
Whoa!
He's actually stopped breathing.
Clear.
Without intervention, he's likely to die.
That's better.
I need you to save me now.
From receiving.
It's a hectic day in the ED at the Royal Melbourne Hospital, with another chopper on the way. Emergency Department assistants Sandra Nash and Pascal Nkurunziza head to the rooftop.
We've got a trauma call coming in. We're just waiting for the, I think it's HEMS 5, so we've got to unload them and actually take them down to Trauma 1.
But before landing, Sandra needs to make sure everything's safe.
And we make sure that we've just got a few supplies just in case we need it. We come and make sure that it's all okay, that there's no debris in the drop mats here. We just do a visual, make sure that the windsock's okay, nothing's fallen off up the roof. We do a check of where the helicopter actually lands. This is why we do a pad check. That's a bit of debris that was actually on the pad. So if a helicopter was coming in now, it could go towards the helicopter, damaging it. The downdraft of the helicopter is like extremely loud, and anything that's on the helipad is going to be like a torpedo.
Down in ED, it's the start of a new shift for Emergency Registrar Dr. Tinny Chang, and she's been immediately called to Trauma Bay 1.
Hi there, Sandy. I'm Tinny. I'm one of the emergency doctors. You're at the Royal Melbourne Hospital, OK?
The patient is 60-year-old Sandy, a construction worker who's been raced into ED after falling at work.
Everyone ready to roll? We'll roll on 3, 1, 2, 3. Ah! Sorry, mate. Ah! 1, 2, 3.
Oh, my back! Oh, come on, stand up.
No, you're almost there.
All right, Sandy, we're almost there, OK?
3 to the side of possible. 3, 1, 2, 3. Sorry, mate.
Lana, we'll get the vitals, and then if we can, we should prioritise trying to get a collar on if we can. Thank you. And we'll take handover whenever you're ready.
This is Sandy. He was at work today unloading a semi-trailer by himself. So all of this was unwitnessed.
My name's Jack, I'm one of the doctors here. How are you?
Looks like he's fallen off either a semi-trailer or a forklift.
It's pretty concerning. Because no one was there to witness the fall, we don't actually know how he fell, why he fell, and Sandy at the moment is confused and unable to give us a reliable history.
He's then presented to the front office, bleeding from the head, the nose and the mouth. Slurring his words, very confused.
Can you be around for me?
On our arrival, he was complaining 10 out of 10 back pain. He's complaining of a headache with a bruise to the occiput area.
Most concerning is that he's definitely got clear evidence of a head injury. He's got this large swelling to his head, extending from the front all the way towards the back, and he's quite confused as well.
Do you want 25 mics of RV fentanyl? Are you happy for that, Tim?
Yes, happy, yep.
Just giving you some pain relief.
Sorry, Sandy, just popping a collar on at the moment, OK? Keep your neck nice and still. Sandy, open your eyes. Can you tell me, where are you at the moment? You're not sure? OK, that's all right. You're at the Royal Melbourne Hospital, OK?
He's quite drowsy, a bit confused. This makes me worry whether he could have something more serious like a skull fracture or internal bleeding within the skull itself.
Sandy, do you have any pain anywhere at the moment?
Or that.
Just your back? Do you have pain anywhere else?
No.
No?
Bit of a headache.
Bit of a headache?
If Sandy's got bleeding within the skull, it can be an emergency situation and can be quite time critical.
Experienced emergency nurse Lucy Stranger is taking a well-earned breather from the busy ED floor.
The longer you've been in the job, the more you prioritise your break. You realise it's really important just to stop, check in with yourself.
Nurse Lucy is well known for her special snacks.
A salad sandwich. The spinach is from the garden, from my garden, and soon the tomatoes will be from the garden, but not yet. People tease me about my salad sandwiches until they're completed and then everyone wants a bite. Sometimes it's hard to turn off even when you're up here, depending on what's happened downstairs, but a moment to sit down's a good moment. I've done this for 13 years. I'm still not exactly sure how best to take a break, but making a sandwich, having a cuppa, not a bad way.
No sooner has Nurse Lucy finished her break than she's called back to the ED, where her next patient is waiting.
So you've got any pain there now?
It's just like a dull ache.
Okay, doll.
And twinges.
Yeah.
Georgie, who has a history of heart problems, has been rushed into the ED after suffering agonising chest pain for 3 days.
It was really horrifically painful last night, no sleep, so I thought, don't want another night like that.
Despite terrible symptoms, Georgie didn't come to hospital right away, as she had no one to look after her dog, Bobby.
That's the reason you didn't come in earlier.
I know. Won't do that again.
Oh, dear.
Having seen Georgie's medical records,
Injuries on your aorta in the past?
Yeah.
And you've had them fixed. Did you get them fixed here?
Nurse Lucy knows she's already survived major surgeries and is lucky to be alive.
The open heart surgery for the ascending aorta, that was done here.
Georgie's had 2 operations on her aorta in the past. Our aorta is basically the highway from our heart. It's the big blood vessel that comes from the heart, pumping oxygenated blood out to the rest of the body. So it's very important.
If you ever look at the X-ray, just bring that up.
Before heading in to see Georgie, emergency doctor Zahir Jayhoon quickly gets up to speed with her history.
So she's essentially had multiple previous repairs with multiple previous dissections. And so she's got a graft from the aorta that goes all the way down the abdomen.
Wow, look at this.
Yeah.
That's epic.
Yeah, I've never seen something like that before.
Georgie's previously had an aortic dissection, sort of like a crack where blood can leak out, and if the crack gets any bigger, then that can be an aortic rupture, which is as deadly as it sounds.
Hi, Georgie. So last night you had some chest pain.
It went down towards the chest.
Yeah, right. And down the left arm as well.
Yes, and the neck was the worst.
Oh, yeah. Did you feel lightheaded at all?
Don't recall
That's
being
okay.
lightheaded. Terrified.
Are you in pain at the moment?
It's just a dull pain.
Sure. Whereabouts do you feel
Kind
it?
of here.
Sure. Okay. Do you mind if I have a listen to the heart and to the lungs? Is that okay?
Yeah.
Yeah?
Dr Zahir needs to urgently assess Georgie to know if her pain is related to her past surgeries or is something completely new.
Your blood pressure is quite different, so the one on the right's a lot lower than the one on the left. Try and take some nice slow breaths in and out for me. Okay.
The fact that there's a blood pressure difference between the left and the right arm means that it's much more likely that she does have an aortic dissection.
And again?
I'll breathe.
Yes, please.
When I listen to Georgie's heart, I can hear a murmur that tells me that the blood isn't flowing the way it should. It's worrying because it could mean that there's a tear in the aorta that goes into the heart, which makes me very worried.
When did you have this aortic repair done again, Georgie?
The ascending 2011
Yep.
and descending 2013.
Have you had any since then or anything?
Well, I had to have 2 corrective surgeries.
Yeah.
Because Georgie's had that major operation in the past, there's additional complications we could be facing. Could she be having a leak within that? If she does have a leak, they are notoriously difficult to fix. Or Georgie could be having an aortic dissection, which could be catastrophic.
I'm quite worried there might be something wrong. So what I want to do is I'm going to arrange for an urgent CT scan.
Okay.
Even though you're feeling well within yourself currently, I'm quite worried there might be something a little bit more sinister going on.
Retired businesswoman Georgie, who has a history of heart problems, is next in line to have a CT scan to find out if she has a life-threatening tear in her aorta.
Did you want me to give your sister a call to give you an update?
She's all ready to come in.
I think it's important for you to have someone, a support person.
Okay, I'll text her.
Georgie's twin sister Helen has been waiting by the phone for an update.
Right now, I feel scared to death. If I was to lose Georgie, it would be such a heartbreak. I just couldn't bear it.
Hello, I'm Jamie. I'm one of the nurses. I'm going to go to CT with you, okay?
Georgie is good fun. She's adventurous. She'll give anything a go, and she loves life. And her dog, Robbie.
Please breathe in and hold your breath.
Georgie's having some contrast injected. What we're looking for is whether that contrast starts leaking.
If there is a leak or a dissection, contrast will leak out of the vessels into areas it shouldn't be, so it'd be really obvious to see. Georgie's had previous scans of her aorta, so that gives us something to compare to tell us is she having a leak or not, and whether or not we need to act urgently.
Sorry, that took a little bit longer than we anticipated.
The results of these scans will determine if Georgie needs another life-saving surgery.
All right, so her coronaries, there's contrast going in, there's no dissection.
Yeah.
But that's a new leak. You can see it's 4 centimeters, so the end leak is extended.
Thankfully, she doesn't have a dissection, but worryingly, she does seem to have a leak. Comparing Georgie's scans shows us that the leak has doubled in size.
So do you think I'll be going home tonight? Or?
I think let's just play it by ear.
I'm very concerned for Georgie at this stage. This is a life-threatening condition. She looks okay, but that could change like that. I need to speak to the surgeons urgently to try and work out if Georgie gets rushed to theatre straight away. So every second counts.
Can you tell me, where are you at the moment?
60-year-old Sandy is dazed and confused and has crippling back pain after a suspected fall from a semi-trailer.
This is unwitnessed.
Unwitnessed.
With no one having seen the accident, details are sketchy. And Dr. Tinney is worried Sandy hit his head hard and has a brain injury.
Haven't checked the pupils just yet. Sorry, I was just having a look at the head. Can you open your eyes? Sandy, open your eyes. Good man. All right, sorry, I'm just going to shine a bright light in your eyes, okay? Can you try and open them for me?
Open your eyes.
Open your eyes. They're reactive. About 3 millimeters. Sorry, just checking the other side. That's 3 millimeters bilaterally and equal and reactive to light. Do you remember what happened?
Yeah, I fell off the truck.
You fell off the truck. Okay. Did you feel unwell before you fell? Did you feel dizzy or no chest pain, nothing like that? Okay. So you accidentally slipped or what happened?
Slipped.
You slipped, okay. All right. And then you fell backwards or forwards?
Backwards.
Backwards, okay. And do you know if you lost consciousness or not?
No.
No, you didn't lose consciousness.
Pick up the questions for you, Sandy. Who do you live with at the moment? Your wife? Okay. What's her name?
Carmelina.
Carmelina.
Sandy's wife Carmelina was at home when she heard the terrible news.
I was waiting for Sandy to come to join me for dinner. My son Christian rang about 5:20, 5:30 and said Dad had fallen off a truck. I'm just beside myself, very, very worried. Just wanted to get to the hospital as soon as we can. We've been together since we're 18 years old. This is our 39th year of marriage. And he's a wonderful, great guy, great husband.
We'll do a log roll when everyone's ready.
Sandy's back pain could be a sign of a major spinal injury.
A little bit of blood on the sheet, so I wonder whether he's got a wound or something to the back of his head. Dr. Jack is going to have a feel down your back. If it's sore, you'd say yes, okay? He's going to feel down each of the bones in the spine, okay? Does that make sense? Yeah, okay. Everyone ready? Rolling to the left in 3, 2, 1.
Oh!
Sorry, darling. Sorry. Okay. Doing really well.
Oh!
When she's not hard at work in the ED, emergency registrar Dr. Beck Hughes leads a double life as a netball superstar.
So I had my netball grand final last night. We've won every game all season. Lost the grand final by 5. I have been playing netball since I was maybe in grade 4 or grade 5, and I've loved it ever since. I think my family and my partner would definitely say that I'm a competitive person. I disagree with that. I'm a really lovely person. Anyway, devastating.
But Dr. Beck can't dwell on the defeat for too long, as her next patient, Vincent, has just arrived in severe pain.
I'm Beck, one of the doctors here. What's been going on?
Got some pain on this side, so it's just been sharp pain, just struggling to breathe and that.
Yeah. Is it there all the time, or is it sort of coming in waves?
Comes and goes.
Okay. Have you been vomiting?
I did vomit throughout the night.
Any fevers, do you reckon?
I've been hot and cold sweats.
Yeah.
But
Have you had this before?
no, not this
Okay.
pain.
All right. How sore is it at the moment?
It's an 8.
An 8?
Yeah.
Okay. What are you taking for pain relief?
Nothing.
Anyone that comes into the emergency department with abdominal pain, we're working through all the different organs that are in the abdomen. Depending on the other symptoms around that, this could represent something like an appendicitis, maybe gallstones or kidney stones. He might have some sort of gastrointestinal infection. At the moment, it could be anything.
See if I can work out what's going on for you. Okay, is this your first time coming to ED?
No.
No? What?
I'm in ED almost all the time.
Why?
So I've got thalassemia.
Yeah.
So I think it's my liver.
Do you know what kind of thalassemia you have? Major. Do you have to get regular
Yeah, I come in
transfusions?
regularly. Correct.
All right. Do you have any other medical
No,
conditions? No, just the thalassemia. All right.
Thalassemia major is a really significant chronic condition for a young person. Back before we had treatments, it was life-threatening. These people didn't make it to adulthood. Vincent's treatment includes having regular blood transfusions, but there's also a number of complications that come from needing regular transfusions, including high iron, liver problems. It would have a serious impact on his life. If Vincent didn't have regular transfusions, it's very likely that he would die.
So what do you do with yourself?
Just project manager.
Okay, yeah. Like on a building site
Yeah,
or something? Oh, all right.
30-year-old Vincent has lived with this serious condition since he was born. Trips to hospital are part of his everyday life.
My white cells eat my red cells, so I don't produce enough blood in my body. So I come in regularly for blood transfusions, get 2 units of blood every 2 weeks. It has its days, has its up and downs. I've got a 4-year-old daughter. She's pretty much what keeps me going. I'm still walking, still breathing. So that's how I look alive now.
You've never had this before?
No, so I've had kidney stones.
Yeah.
Which I've still got kidney stones.
That felt different?
Yes.
Okay.
Yeah.
Have you ever had a surgery on your
I've
stomach?
had multiple surgeries.
Okay.
I've had a spleen, ruptured bowel.
Mate, I asked you, I said, what's your medical history? And you said thalassemia.
Oh, thalassemia.
So funny.
I imagine for Vincent, he's really sick of coming to the hospital. He's sick of seeing doctors. He's sick of having to explain his story over and over again to a new person. And so I completely understand why he's not really forthcoming with all of his medical history.
Okay, so tell me, ruptured spleen.
So spleen taken out.
Yeah.
Ruptured bowel.
How did you rupture your bowel?
Don't ask me, I don't know.
When Vincent pulls up his shirt and shows me all of these previous operations and complications that he's had from his thalassemia, it suddenly clicks that we're dealing with a really serious chronic condition here, and I need to be really careful and thorough about working out what's causing his abdominal pain. He's going to need a little bit more of a workup and investigations than the average patient that comes through the emergency department. Can you take a big breath in and out? Sore?
Yeah.
Yeah.
Everyone ready? Rolling to the left in 3, 2, 1.
Oh! Dr. Tinney and the team are checking the spine of 60-year-old construction worker Sandy for a broken back and head injury after he fell backwards off a semi-trailer.
Sorry, darling. Sorry. Doing really well.
Just a graze here. Oh, no big laceration.
Okay.
Oh, my back.
Sandy, you're doing really well.
Oh.
Okay, good job, good job.
Oh, my
Alright, feeling down through the back. Any pain here?
Where?
Where he's
where
pressing?
I'm pushing. And where I'm pushing?
No.
Okay.
Is there pain there?
Little.
Little?
Little bit, okay.
Yeah.
A 2.
Oh, yeah.
Sandy's got quite a lot of pain, especially as we go further down the spine. He may have seriously injured his back or sustained some fractures to his spine.
All right, rolling back down in 3, 2, 1. Sandy, just rolling you back down now.
Oh.
All right, good man. All right. Sandy, we're just going to give you some pain relief, okay?
Oh, my back.
I know, you're a bit sore. We'll give you some pain relief to help with that. We're going to do a full scan of your spine and the rest of your body, make sure we're not missing any injuries, okay?
Oh.
All right.
We're just going to take you for a CT scan, okay?
Finally, Sandy's family arrive, desperate for news.
Hello, I'm Tenny. I'm one of the doctors. We've got a family room. Maybe I'll take you around there and then we can give you a bit more updates. He's just at a scan at the moment. I've spoken to okay. We need to do some scans of the brain, make sure there's no bleed, make sure there's no fracture. Yeah. The other thing is we just need to make sure he doesn't have any fractures in his spine.
It can be quite a difficult conversation to have with family members, especially when they come in and their loved ones are seriously injured or confused and not themselves. I want to reassure Carmelina that we are doing everything possible that we can to help Sandy.
Okay, Sandy, I'm just going to hold your hand.
Hi, good afternoon. This is Zahir, one of the ED registrars.
Dr. Zahir is consulting a vascular specialist about the potentially life-threatening leak in Georgie's aorta.
Comparing the last CT angio that we've got on file, the radiology reg said that the leak's doubled in size, so from 2 to 4 centimetres.
He needs to find out whether or not Georgie needs an emergency operation.
Okay. I'm with you. So she will need some sort of procedure. Yep. Okay. Thanks for your help. Cheers, bye.
Georgie does face a big operation ahead, and that is something that concerns me. Because she's had these operations in the past, it makes it even more tricky, and there's every possibility that she might not make it.
Had a look at the scans.
Yeah.
Now, on the scans, it looks like you potentially have a small leak. It's about 4 centimetres. I've had a chat with the vascular surgeon. He's had a look at the images. It is something that will likely need an operation.
So I am being admitted?
Correct.
This would be Georgie's third life-saving operation. It's a lot to process. And until her twin sister Helen arrives, she'll have to cope with the news on her own.
How can we stop that happening, what happened last night?
The pain?
Pain.
Well, look, you're in the right place for it. So if you've got any pain, you let us know and we'll give you some medication to bring those pain levels down.
Right.
Okay?
I can see that Georgie's trying to put on a brave face, but she seems a bit worried and concerned, and that's understandable. Even though Georgie might look okay at the moment, that could change very quickly. These leaks can be unpredictable. She can go from how she is now to being in a dire situation.
Fortunately, Georgie's sister Helen arrives in time to give some much-needed support.
Hey, how are you? You okay? I'm probably going to need a leak in the water. A bit of nerve break.
It's really hard to hear that my sister needs to have another big operation. Terribly, terribly hard. It's hugely scary. There's always that thought and that fear that things could go wrong and I might not see her again.
I'm in very good hands, Helen. Oh, you are? Yeah. You are.
So from here, Georgie's going to go to the ward. She'll be closely monitored. There's going to be a lot of planning by the surgeons to try and work out just the right way to do it for her. But I expect her to have this procedure in the coming days.
See ya.
Big operations like this are inherently risky. While on the one hand, things could go well and Georgie walks out of hospital and gets back to her life, there's also the possibility that things don't go as well as we hope and that changes her life forever.
Just order some bloods.
Dr. Beck is trying to find out what's causing 30-year-old Vincent's severe pain.
We see a lot of people come in with abdominal pain, but we don't see a lot of people with thalassemia major coming in with abdominal pain. I really do feel for him having to deal with a chronic health problem at such a young age.
Because Vincent's thalassemia isn't curable, it makes it tough to diagnose other conditions.
I'm always in hospital, pretty much. If it's not one thing, it's another. So they call me the mystery patient. It is frustrating, because when you come in with pain and then they can't figure out what's going on, but at the end of the day, there's nothing that I can do.
We've taken some blood tests to have a look at Vincent's liver function and his kidney function and looking for signs of infection. What I'm looking for is there any change to what his baseline function is. Are you guys using this?
While Dr. Beck waits for Vincent's blood test results,
I'll just set this up.
She's hoping an ultrasound will help get to the bottom of his pain.
I'll just wait for Martin. We'll have a look, see what we find.
For such a complicated case, Dr. Beck needs some expert help.
Hello.
How are we?
I'm good. I'm Martin. I'm one of the emergency doctors. What's your name?
Vince.
Hi, Vince. I might lie you flat. Are you all right lying flat?
Yeah.
He hasn't had any pain relief, but he doesn't want any.
Sure.
But yeah, just yell out if it's getting too sore. That's the liver.
It is.
It is.
There's not a lot of free fluid between that kidney and the liver. Happy?
Yeah, happy.
All right.
It's a good sign that the liver itself looks okay.
Do you reckon you can find his gallbladder? It's a bit tricky.
You have to go.
Well, just pop back to where you were before.
That's the vein.
Stop. Right? So have a look here.
Dr. Martin has spotted something alarming.
So there are these little white things.
Yeah.
And then behind them, they've got a little shadow. Do you know what they are?
Gallstones?
They're lots of tiny little gallstones. They're about the size that you'd have in a fish aquarium.
Do you want to have a look, mate? So what? See those little things in here? That's what we're looking at. Okay.
Now, his underlying disorder probably makes him more likely to produce gallstones.
Vincent does in fact have some gallstones inside his gallbladder. The question remains, are the stones actually causing him his symptoms? Because if we went around the emergency department and chucked a probe on everybody's tummy, we would find that a lot of people have gallstones, but it's not actually causing them any problems. I still can't be sure what exactly is going on for Vincent. Still an unknown for now, but hopefully we'll get to the bottom of it. What I'm going to do is have a chat to the surgeons. They're the team that manage you if it's a problem with the gallbladder or the liver.
30-year-old Vincent has stones in his gallbladder and may need immediate surgery to remove them.
I think you probably shouldn't eat or drink.
Yep.
For now.
Vincent came into the ED because of terrible stomach pain, but Dr. Beck can't be sure the gallstones are the cause.
Do you have any questions for me at the minute?
Not at the moment.
Okay. Vincent's still in a lot of pain. We've given him some pain relief, but he still looks really uncomfortable. Given this has already been going on for 5 days, I think we need to get onto this quickly.
Oh, hey, it's Becky, one of the ED Regis. I'm just hoping to refer a patient to you for a surgical opinion. You'll come and see him next. Okay, thanks, bye.
Vincent's blood results are in, but they don't help to solve his mystery pain.
Kidney functions. Okay. That's actually really reassuring. And his CRP's up slightly. I'll just go let him know. Okay, I've just been on the phone to the surgical team about you, and I've got some of your blood tests back.
Okay.
Your blood tests are actually really reassuring. And the liver function, it's pretty much the same as it was, so that's good news.
Yeah.
The surgeons are actually just going to come down here and see you and have a feel of your tummy and a chat with you about whether they think you need to be admitted.
I'm just going to sit tight and wait, because I just want to get to the bottom of it.
I've just spoken to the surgical unit and they're not entirely convinced that Vincent's pain is caused by gallstones. He's coming into hospital firstly for some pain relief. They're planning to do some additional investigations and then a discussion based on those tests about whether he needs any sort of surgery. Vincent warned us from the beginning that he was a bit of a mystery man, and certainly he's proven himself right today.
I hope it all works out.
I hope so.
Hope you don't need another operation.
Fingers crossed.
Fingers crossed, eh? All right, good luck on the ward.
Thank you.
Okay.
Mystery patient. Because I can never find out what's wrong. Ever.
Your bed's ready up on the ward. Yes. Are you happy to walk on?
Yeah.
All right, not too good.
Okay, Sandy, I'm just going to hold your hand.
60-year-old construction worker Sandy's life could be about to change forever after he fell backwards off a semi-trailer.
Hey, Sandy, I know it was sore before. We're going to go nice and quick. We're going to pop you into the CT scanner. Bit of a bump onto the CT table. Okay, ready? 1, 2, 3.
He's got a small abrasion to the back of his head. That indicates that he's had impact or struck his head against something, and certainly we'd be worried about more internal injury within the brain.
With the scans completed, Sandy can return to the trauma bay, where his wife Carmelina and kids Olivia and Christian can now finally comfort their loved one.
You've got some friends here, darling.
Yeah.
You do? Hi, guys.
Get up. Oh.
Sit.
Hi, Dad. Oh.
Dr. Tinney is about to find out if Sandy's life will ever be the same.
This is his lumbar spine. This is where he was sore. There's no obvious fractures that we can see over here. When he fell, he's probably injured some of the muscles and the soft tissue around there, and that's what's causing his pain.
Although Sandy's spine looks okay, his head is a different story.
This is a CT of his brain and also of his skull. We suspect that he does have some bleeding within the brain.
Unfortunately, Sandy's got some bruises to the brain and a small hematoma, which is a collection of blood outside of the brain as well. In the following hours to days, there is the risk that it could get larger and he could have more severe symptoms. Things can get very bad if the bleeding gets worse.
There's a skull fracture that extends all the way to the vertex.
He's also got a fracture of his skull on the right side.
That's the crack.
Dr. Tinney must now break the devastating news.
The CT scans did actually show you do have a fracture in the skull from hitting your head quite hard. And it seems that there may be some evidence of some bleeding as well, okay? We're going to have a chat to our neurosurgical team at the moment as to, whether they want us to just monitor for the time being or whether they want to do anything about it. Do you have any questions? Sandy? No? Okay, all right, darling.
Recovery from head injuries can vary a lot. It's really important that he's monitored closely in hospital under our neurosurgical team, where they can continue to monitor his brain function and also organise some repeat imaging to make sure that these injuries and contusions do not continue to expand and progress.
If you get really severe pain, let us know and we can give you some more pain relief.
Sandy suffered a traumatic brain injury. In the coming days to weeks, Sandy will benefit from having such a supportive family to aid him in his recovery.
Retired businesswoman Georgie came into the ED after suffering agonising chest pains for 3 days.
And down the left arm as well.
Yes, and the neck was the worst.
With a history of heart problems, Dr. Zahir and Nurse Lucy were worried Georgie could have a life-threatening tear in her aorta.
She's got a graft from the aorta that goes all the way down the abdomen.
That's epic.
Yeah, I've never seen something like that.
No.
Okay.
CT scans revealed there wasn't an aortic tear, but there was a dangerous leak.
I've had a chat with the vascular surgeon. It is something that will likely need an operation.
So I am being admitted.
That's correct.
After many tests and 2.5 weeks in hospital, Georgie is now at home.
They were looking into the leak in the aorta. The second day I was there, the nurse said to me, "You've got a rash on your arm." So she went off and came back with the very bad news that I had shingles. Cheers! It turns out the pain that I rang an ambulance about was shingles.
Luckily, Georgie didn't require surgery on her aorta.
They discovered the leak had been there for quite some time, and all I had to do was have checkups, and if I got symptoms, I needed to ring emergency straight away. So that was very good news. Off we go. While I was in hospital, I was worried about Bobby. He's never, ever spent a night away from me. Gentle, but I had wonderful friends and they took him on very willingly. He's having a good time.
Georgie is forever grateful for the support of her loving sister.
I can't say how wonderful Helen was. I could almost cry, actually. She was in there every day, supporting me.
For now, Georgie only has one thing to do.
The doctors have told me that I need to get a lot fitter. So I've been trying very hard to eat the superfoods and walking Bobby. I think that's one of the best things you can do for most problems, is to get out in the fresh air and walk and thoroughly enjoy it. Come on.
What's been going on?
I've got some pain on this side.
30-year-old Vincent came into ED with severe abdominal pain.
How sore is it at the moment?
It's an 8.
An 8?
Yeah.
Okay.
Vincent's a regular at the Royal Melbourne, as he lives with a serious condition and needs fortnightly blood transfusions.
My white cells eat my red cells, so I don't produce enough blood in my body.
An ultrasound showed Vincent had multiple gallstones.
The surgeons are actually going to have a feel of your tummy and a chat with you about whether they think you need to be admitted to hospital.
So I just want to get to the bottom of it.
Vincent stayed in hospital for 2 weeks and had an operation to remove his gallstones and also kidney stones. He's now pain-free and enjoying life with his daughter Sienna.
1, 2, 3.
Construction worker Sandy was rushed into the ED with 10 out of 10 back pain after falling backwards off a semi-trailer.
Oh, the back.
Is there pain there?
Oh, yeah.
As well as spinal injury, Dr. Tinney worried he could have a head injury.
We suspect that he does have some bleeding within the brain.
CT scans confirmed Dr. Tinney's fears.
There's a skull fracture that extends all the way to the vertex.
5 months later, Sandy is doing well after a long recovery.
The skull obviously been fractured and I wasn't allowed to drive for 3 months because I had bleeding in the brain and needed that for it to settle. There was no real treatment. I couldn't move, just pretty much just lie in bed. That's what it was all about and do the time.
Sandy remembers the fateful day when he thought his life may be over.
I drove up with my machine to the back of the trailer and I climbed up on the back of the truck onto the load. I had a visual looking from the air and seeing myself fall backwards. Obviously, I wasn't ready to go and I've gone back into my body, so, yeah.
Come on, little garden.
An important family celebration was the perfect motivator for his recovery.
I had my son's wedding. I had to be there. I owed it to my family. They gave me so much support and I thought, I'm going to be there and we're going to enjoy it. And we had a great night, something to cherish for forever.
The street's beautiful up there.
Sandy's thankful he has Carmelina by his side.
I think to myself, what have I done to deserve a beautiful woman like this? She's a blessing. She's my angel. My neurosurgeon said, you're fine to go. Go out there and enjoy your life. And that's what I intend to do.